Hey everybody, it's Matt Shu from Upright Health and welcome back to the Upright Health Podcast. In today's episode, I am thrilled to be talking with Cathryn Jakobson Ramin. She's an investigative journalist who wrote an amazing book on back pain. The book is called Crooked: Outwitting the Back Pain Industry and Getting on the Road to Recovery. If you have back pain, you need to get this book, and if you know somebody with back pain, you need to give them this book. In today's episode, we are going to talk about some big topics in back pain. We're going to talk about PRP injections, we're going to talk about stem cell injections, we're going to talk about X-rays, MRIs, disc degeneration, arthritis, and what all that has to do with back pain. And we're going to talk about concrete steps that you can take to help yourself get out of back pain without unnecessary procedures that doctors want to push on you. I know you're going to get a lot out of this episode. Here we go. First of all, Cathryn, I want to say thank you for joining me today on this call. For those of you listening who are not familiar with Cathryn's work, she has been an investigative journalist for 4 decades. She's been a public speaker. She's published a New York Times bestseller, Carved in Sand: When Attention Fails and Memory Fades in Midlife. And this book that we're talking about today, Crooked, is the result of over 6 years of research into the back pain industry. So we are talking today with somebody who really knows the ins and outs of the back pain industry and has really gone through the trenches herself. So Cathryn, the first question I want to ask you is, what really inspired you? What really called you to write this book?
Well, as anyone who has taken a look at the book knows, I had problems with my back from the time I was a teenager, and I always managed them. You know, it was a minor inconvenience, but I took care of it. I exercised, and I lived a perfectly normal life. And it wasn't until really the time that my first book was published, and I went out on the road to do a lot of talks to various groups all over the country, and I found myself in just agony. My back was really bothering me, my hip and my leg, and it occurred to me that unless I figured out a way to deal with this, I probably wasn't going to be writing a second book because the books I write require a large amount of travel and interviewing and strange and airplanes and strange taxis and bad car rentals and awful motels. And, you know, it's not the most pleasant experience. Although, as I always say, it's a lot better than working at the airport. But, you know, it's not the most pleasant experience. So I decided I had to do something. And like most of us, I thought, well, you know, it's a medical problem. It'll have a medical solution. And I just need to go find myself the right practitioners, and off we go. I'd already done a fair amount of physical therapy. I think I've been through 3, full sessions of physical therapy. And I had also seen chiropractors, and I'd had, done strength training with exercise machines. I'd done yoga. I'd kind of been around, and I made the assumption that if that stuff hadn't worked, and clearly it hadn't, then what was needed was medical intervention. Mm-hmm. And as I started to look around, I realized that from the perspective not only of the patient, but of as an investigative reporter, which I have been for 4 decades, the evidence just was not good. And I sensed a lot of shenanigans. Unfortunately, I sensed those rather late in the game, after I had actually made the rounds of the MRI machines and had a quote-unquote minimally invasive surgery, which I'm sure was not necessary and certainly not to my benefit in the long run. So that's really how it happened, because I noticed that patients had no idea what they were signing up for, and because they were understandably in pain, as I was, they had a tendency not to look too closely. So they found themselves very often in a massive heap of trouble, and that is what spurred me to write the book.
So can you speak to that point? So you said when people are in pain, they don't look too closely at what's going on, or they're not informed about what's going on.
It's like, okay, you look around, you go, I got to get out of this pain. It's affecting my work life. It's affecting my home life. I'm losing friends because I don't want to go anywhere. I've got to do something about it. And human beings are expedient folk, and we're looking for the first thing that seems plausible. And every week, and even just this morning already, I have had contact from people who say, oh, wow, I read about this cool thing on the internet, and it's PRP, or it's stem cells, or it's even today, artificial disc replacement. And boy, that sounds like a good plan. Or what about this form of minimally invasive? Or how about this new injection? And, I totally understand, because I was there. But when you're in pain, you tend not to be willing to sit down and study a 2-foot-high stack of peer-reviewed papers from medical journals.
Right. It's funny because I also receive emails like that, and we work with clients who ask us all the time. It's funny you mentioned PRP, but people ask us all the time, like, oh, should I do PRP for this? Should I do stem cell injections or whatever? So I'm curious, what kind of response do you give, or do you give any response when you see those emails?
I'm not a doctor. I'm not any kind of medical professional. I'm not any kind of therapist. I'm an investigative reporter. And so I work with what material is at hand. And that typically is a matter of looking at the evidence. And the evidence is very clearly that PRP and stem cells are not currently considered to be effective in the treatment of back pain. They may be more effective in the treatment of knee pain and shoulder pain. I don't debate that at all. But because, and I'm not, I think one day maybe we will find a way to use these in the treatment of back pain. And I've certainly had my cage rattled a bunch by practitioners, usually anesthesiologists or interventional physiatrists, who have decided that this is perhaps the best way for them to continue to practice in this field, and who really want to convince me that this works, but they haven't been able to show me numbers, because it hasn't been going on long enough. For one thing, they don't have a sufficient number of patients to enroll. And I really wouldn't buy it until I could see that 5 years out, people are significantly improved. I mean, frankly, everybody thinks they're significantly improved by absolutely everything in the first 5 days. That is not a good, especially if you just spent $10,000. So that's not a good indicator. And because we know some stuff about the biology of the intervertebral disc, that includes the fact that it is an anaerobic environment, meaning that in a vaguely healthy disc, there's really no oxygen. And the only way that it is fed is by nutrients coming through the vertebral plate into the disc, and then they pass through and they go out the other side. Or there's a kind of a hydraulic system that goes on. So imagine squeezing, releasing, and that's how the disc eats. That's how a healthy disc gets its nutrients. But what it does not have is oxygen. And so that means that it's very hard for the cells inside a disc to survive under the best of circumstances. Even they have a hard time, and they die off as we get older. So now imagine you take a disc that's not healthy, and you put baby stem cells in there, and they don't have sufficient nutrients. They don't have sufficient oxygen supply. They don't have, to my knowledge, which has to change on a daily basis because this is an emerging field, but they don't have what it takes to survive. So you're injecting stem cells into an environment where they'll die. And and I don't think that anyone has shown me yet that they've really found a way around it.
Wow, that's fascinating. I hadn't heard that.
I hope to do a podcast myself about stem cells in sometime in the next year, but each one of these podcasts takes me about a lifetime to put together. So it may be a little while. And anyway, it's an emerging field, so it's okay, right?
It's absolutely okay. And I would definitely be looking forward to listening to that podcast. So you mentioned, injecting things into the spine here with stem cells. There was a part in the book where you talked about a paste, if I remember correctly. It was like some sort of a solution that would be injected into the vertebrae ostensibly to improve healing of fractures of the vertebrae.
Oh, well, that's vertebroplasty. Vertebroplasty, which has now really been shown to be entirely unnecessary.
So could you break down what vertebroplasty is for people?
Okay, well, vertebroplasty is typically used when someone has a vertebral fracture and a vertebral compression fracture, which generally occurs in older people. It is often related to osteoporosis, and it's awfully painful when one occurs. But the studies have shown that there is no benefit a year out, or even, I think, possibly 6 months out. I'd have to go back to the studies. A year out to that procedure. And it is costly. It has risks, especially for older people. And it seems that it is basically entirely unnecessary and uncalled for. If some of your listeners might like to go to Crooked's Facebook page, so that's Crooked: the back book, and there I regularly post new and important studies.
Oh, great.
So you can find that study is, I think I posted that maybe about a week and a half ago, but they're all there. And it seems, I have a lot of, the page has a lot of Facebook followers, because if you're in the business per se, there's stuff you really want to know, and I will post studies from peer-reviewed journals. And then there's a lot of other things that are really a little bit more oriented to the back pain patient.
That sounds fantastic.
So be sure if your listeners are going there, that they go to Crooked: the back book. They don't go to my personal Facebook page, because they won't find what they're looking for there.
Great, another place for me to waste time on Facebook.
Yeah.
Not waste time. It's not wasting time.
Well, it's great. I think it's very important for people to know what's being published, because it's true that you can find a study to support basically anything. But unless it really comes from an eminent journal, it's not worth your time. And it's very hard for people to tell the difference between marketing and actual evidence. And there's a lot of lying and cheating that goes on.
So there's a couple of things that I want to unpack there with you. I actually want to backtrack slightly. You had talked about disc damage, and I was wondering if you could talk a little bit about the whole story of spinal arthritis and disc damage that shows up in X-rays and MRIs, and how that relates or doesn't relate to people experiencing back pain, and what you found through the studies you've read.
Well, what is now very much confirmed is that what we see on scans, on MRIs and X-rays, does not necessarily relate to the pain that the individual is experiencing. And if you compare a healthy group of individuals who have had MRIs for other reasons, or else they were used for experimental purposes, you will see that people have all kinds of artifacts in their spines. They have herniated discs and they have spinal arthritis and their facet joints look weird and things are black and things are out of alignment. And this is true of people who do not have back pain. It's universally true. And yet, because we, as a society, understandably, look to physicians for answers, it has become customary to get an MRI and see these artifacts, these anomalies, quote unquote, which are not, in fact, anomalies. Mm-hmm. And, radiologists, this is changing now, and I think maybe partially due to my book, but radiologists send back reports that say, a degenerative disc disease at X level, and people absolutely freak. But what they don't realize is that most people have degenerative, quote unquote, degenerative disc disease. It is not a disease. It's no more than my, gray hair or the fact that I need glasses because I'm 61 is a disease. I mean, it's unfortunate. I'd rather not have either one of them, but it is perfectly standard. So many people are, every day, I'm not kidding, I hear from 2 or 3 people who are really freaked out because they've been told that, they have disc herniations at this level and that level and a black disc here. And now the favorite diagnosis is actually instability, because insurance companies have largely stopped paying for surgery for, it's not an indication. Degenerative disc disease is not an indication for surgery anymore. So they've found some new indications, and instability is definitely one of them. Now, let me add that it's a pretty good indication, because what is still being paid for is really disc decompression procedures, like microdiscectomy, laminotomy, laminectomy. These are procedures which are meant to, one way or another, take some of the pressure off the nerve, the afflicted nerve, and they're still being paid for. So there's a lot of those going on, and they're being done more often. And if you keep pulling out bone and you keep pulling out disc, you will be unstable. And then guess what? You'll be a candidate for spinal fusion surgery.
Which in itself, I remember reading there were some pretty shocking statistics you had in there for success rates for spinal fusion.
Yeah. Well, because spinal fusion surgeries are usually performed on people who understandably have not been very active. They are sometimes overweight, often to the point of obesity. They're very deconditioned. They are frequently dependent on opioids. They are just terrible candidates for surgery, for any kind of surgery. Mm-hmm. So the fact that frequently their spinal fusions are not successful is not that surprising, because they were bad candidates for surgery. My brother recently did have a 1-level spinal fusion. He had a situation where he had a cyst that was actually in the joint, and it was being compressed constantly every time he stood up. That thing had to go, and he was not particularly stable. They did fuse the joint, and he's an athlete and in tremendous shape, and knock on wood, he's doing very well. So it's not a terrible sentence for everyone. Unfortunately, the people who undergo it are frequently not in a good position to recover.
So you mentioned the condition, right? Decondition. So that's something that as trainers we see a lot, right? So people come in, they're complaining about all kinds of things hurting. They've gotten the scans. They say, well, my back is arthritic, or my hip supposedly has this torn, and my shoulder is...
Great. I notice everyone has something torn in their hips recently.
Yes, it's a huge growing diagnosis, with the surgery rates exploding, and it's something that I've personally been doing tons of research on. I think I shared that with you in email. So it's a spreading epidemic. But people come in with all these tears and whatever, and they come in extremely deconditioned, unable to really even pick up a book safely. Their movement patterns, their mechanics.
Wait, let's go. Let's unpack that. They are perfectly able to pick up a book safely. They just think they are. They are experiencing fear avoidant behavior that has told them that something very bad, possibly fatal, will occur if they were to pick up the book, the bag of groceries, or their briefcase.
That's
whatever.
That's a great.
They are not. They are not unsafe. They perceive themselves to be unsafe.
Mm-hmm. Yeah. So they're living. So what we see is their whole lives kind of shrink, right? What they're able to do, what they think they're able to do, shrinks because they've been told, this is damaged beyond anything you can ever fix. And when we see this, from our perspective, it's like, hey, you need to actually just train your body to do these things correctly, right? Just do these in a way that isn't harmful to your body. Pick this up, practice picking up something heavier, practice picking up something heavier. So this, from our perspective, there's this whole conditioning of just muscle, right? Just training that to be able to function correctly, training your mind not to go to that fear zone. Have you seen, from your book, it's clear that you've kind of seen that kind of deconditioning for yourself and for others. Can you speak about what you've seen for, like you mentioned, your brother and his results with surgery? Can you speak a little bit more about conditioning and
Well, my brother is, as I said, he's an athlete. He's 55, and he's really in excellent shape. There's probably not an ounce of fat on him, and yet I really did not want him to undergo that spinal fusion until I realized that the cyst was present and he was not going to get better otherwise. But in terms of deconditioning, it's really a situation where medical professionals and therapists, and even sometimes exercise professionals, say, be careful, don't do that, go easy, rest, does that hurt, does that hurt, does that hurt? And you want, yes, you can see why. I work with a trainer, and she will ask me these questions if it's a known fact that I've come in and I've just gotten off a 7-hour plane trip and I'm all very creaky. She will want to know if she's killing me, but she'll find a new or different way to push me, It's not like, okay, I think you should go lie down on the sofa. It's, we're doing this thing and we're going to find another way around. And too many trainers are really one-trick ponies, they know one story and not more. They know one story. And this is, there has to have a good rehab trainer has to know how to get into the problem zone 5 different ways. Yeah. If it's on your back, if it's on your feet, if it's on your stomach, if it's hanging from the rafters, it doesn't really matter. You got to get there because it will not get better unless you get there. So you cannot, I see a lot of athletes call me or write to me and they say, I've been doing sports my entire life. What do you mean I'm deconditioned? And I said, well, for many, many athletes, particularly those who are not professional athletes who have, coaches like with them all day long. But many athletes, they're very strong in certain places, but they're also very weak in other places. And I think a good example of this is tennis players, because they're, if they're right-handed, the entire right sides of their body is very developed and the left sides are not. And they may have a huge ridge of muscle along the right side of the spine and nothing on the left side. Mm-hmm. And they frequently have nothing going on in the glutes, min or max. Yep. And it's, I always say, I'm sure I've embarrassed hundreds, if not thousands of men at this point by asking them to please show me their glutes. Could you just pick that shirt up? I need to see what you got going on under there. And frequently they're just flat as a pancake if you have back pain.
Yeah.
And I was like that too. I was. And I write about that in the book, so it's no secret. But
I'm so glad you brought that up for everyone who's listening. Actually, a few years ago, I was working with a client, and he came up with the idea of us making a T-shirt that just says "Power to the glutes."
It's a good idea.
Yeah, so I actually have that T-shirt.
If you're glute, there's more. I can think of other better T-shirts to even, it's better with a booty.
Oh, something like that. All right, well, better with a booty. You're gonna write that one down.
We can go into business now with that kind of T-shirt.
Perfect.
I don't think I have a conflict of interest.
Well, we can make a study that looks at the efficacy of wearing that T-shirt. And
just wearing a T-shirt, you don't do anything. You're just wearing the T-shirt, right, man? Well, it's true that people believe somehow that their spines hold them up, and of course, we teach in school, the most arcane topics, but we do not really actually teach anatomy or physiology. And so it is amazing to me how people with incredible educations that I know have exactly no idea of what's going on back there. And the fact that, in fact, your spine will not be holding you up. I mean, if anything, your pelvis is going to be essential in this. Everything about your shoulder girdle will be essential in this. And people, because of the medical model largely, are focused on the spine. It's a little overplayed, to be honest,
I fully agree.
Fix you go in there and do things to every disc. It's not going to help at all unless the body is prepared to support that spinal column.
That's definitely, I think, a huge education piece for people. That's something that we usually are spending weeks, if not months, with new people that we work with. We're spending a lot of time explaining to them, when you pick this up, it's not just about your back per se. Yes, it's doing something, but your glutes, your hamstrings all need to know how to pull on your pelvis, stabilize your pelvis, move it, and your spine, maybe it has to stabilize, but it's not the thing. Those muscles are not the only things working. And really, if you're not using your glutes and hamstrings, you're really forcing your spine to do a lot, right?
Right. And I really believe that most of my issues were from that lack of development. I rode horses as a young person, and I had a lot of trouble actually sitting very straight. I rode English style, and you're supposed to be ramrod straight, and I had a lot of trouble sitting straight. And at one point, my shoulders were in a brace in order to pull them back. Well, if I could not get myself upright, then there was a lot of muscle development that was missing there. And we should have been working on that, but no one knew that. It was like, if you can't do it naturally, we'll just do it artificially. So I really think that it is hard to convince people that they need to develop these supportive parts of their bodies that they don't relate. And of course, most people are, obsessed with the notion of the core. They think that exists somewhere around their navels. And they don't understand that, as far as I'm concerned, the core goes pretty much from your knees to your neck. And if everything in there is not working properly, you are much more likely to have relapses of pain. And it's very hard to convince people of that. And I've had to stop about 1 million people from just doing, your standard crunches because they think they'll strengthen their cores, but meanwhile, they're just destroying themselves. But I think a super important part of this, Matt, is, and one that I just came back from Australia, where I spent a lot of time with Lorimer Moseley and his team. And if you are not familiar with that work, you definitely want to get into it.
Yep.
And we really looked at the psychosocial components of back pain. And these are powerful. And for every chronic back pain patient that shows up, through email or however they get to me, I'd say a grand majority of them are dealing with very stressful life situations, one way or another. And when you are a trainer, you might learn more about their situations than if you were their physicians.
Oh,
I
absolutely.
mean, at least when I walk in whenever I do, twice a week, my trainer says, "So what's up?" And I'll say, "Well, I just heard from my son that blah, blah, blah." Well, that's a stress factor, or everything's fine. But it's that one of the things that Mosley talks about is that when the balance tips in your life and the negative is consistently outweighing the positive, and you are having a hell of a time shifting that back, or you've lost hope, or maybe you don't even remember that it can be shifted, that's where chronic pain can really become entrenched.
This is actually something that we've talked about with clients is, and people who email us about chronic pain stuff, they'll say, well, the doctor said it's got to be this, right? And I had my own very long journey with chronic pain. I had all kinds of issues. Basically by my mid-20s, I was not able to do anything that I wanted to do. I could barely even type for more than a couple minutes.
Jeez.
Yeah. So, my back, my hips, my knees, my feet, everything was just in constant chronic pain. And, over the years, I just got really jaded going to the doctor. And so what I put to clients now and to people now is, just think about the situation. You're going to see a doctor who at a maximum has 15 minutes to talk with you. Do you think that person is going to have a full understanding of everything that's affecting your overall health? That they're going to understand what your body needs to feel better?
Right.
It's such a tall order, right? You can't, I've worked with a lot of people now with chronic pain, but I know 15 minutes is not enough time.
No, 15 minutes is enough to make a medical diagnosis, whether it happens to be right or wrong. And sometimes it's right, and a lot of times it's not, because if it were so right, people wouldn't have seen 20 practitioners, And, as a trainer, you really have an opportunity to, what I say is change the chip in someone's brain. It's hard to do, but focusing on the fact that in the case of back pain, once, all the really noxious things have been eliminated, this person does not have cancer, this person does not have an infection, this person, there's nothing cataclysmically wrong with this person. And we know this because the person has been to 10 doctors, right?
Yep.
At that point, it's really time to say, hurt does not mean harm.
Right.
This is, yes, if you stick your hand on the stove, hurt means harm. But this is not what we call nociceptive input anymore. It is being generated, the pain is being generated by the brain. The brain is not a reliable reporter in this case. So as you know, I have to pick up and go here in the next 6 minutes.
Yeah, so let's actually wrap up. I guess one final question then is, what do you hope people take away from your book, or what can they take away from even this talk? So you mentioned, you can find a study to support anything. Doctors will give you a diagnosis, whether it's right or wrong. What can somebody do if they have back pain, they have these things going on? What should they be keeping in mind to make sure that their backs get better, that their bodies get better, and that their lives get better?
Well, sit down with yourself with a pad of paper and take a look, put a column, write a column down the middle, and on one side, put down what you feel makes you feel safe and good in your life. And on the other side, put down what makes you feel imperiled and victimized. And I think for people who are dealing with chronic pain, they're going to see a lot in that victimized, unsafe column. And then it's time to start to add things to the positive pro column, the safe column. And that could be you're going to see your trainer twice a week and seeing that you slowly, incrementally, with some setbacks, because you will always have them, build strength. You become more resilient. You begin to recognize that your fear avoidant behavior is not doing anything for you. That you may have been told at some point that you should never X, Y, or Z. And there's a long list of things.
Huge
Some
list.
of them are just unbelievable what people have been told they should never do.
Never lift anything over your head. Never.
Right, right. Yeah. So that means like never take a plane because you might have to put something in the overhead compartment.
No, that's bad for you.
Never. And the world, as you just said, it gets smaller and smaller and smaller, and it's not a benefit to that patient, and it will not get that patient better. So you begin to accrue. I really believe this now, and it's something that came to me mostly after my book was published, that if you consistently and intelligently add to the safety positive column, that life gets better and you feel safer and you can be more active. And that means, it doesn't mean, yes, well, what makes you feel good is getting on your sofa with a big, box of donuts. I mean, that might make you feel safer, but you have to be a little more introspective than that, because in the long run, that is not a safety measure. So if it means taking a walk with a friend, if it means, going out and having a drink with a colleague, if it means taking a day off from work and going to walk on the beach, whatever it means, you start to slowly, tiny things. Does not mean quitting your job and, running off with your neighbor's wife. That's not what it means.
The little things.
The little things. It's the little things that count. And moving, consistently is obviously important. And staying the heck out of the hands of internet marketers who want to do things to you. That is not the place to be. So anyway, I hope everyone will take a trip to my website, which is at CJ Ramin, which is CJRAMIN.com. And also maybe to the Facebook page, which is _the back book. And I'll see you. I'll see you online.
Yeah, we will provide links in the descriptions and in the notes for this episode. And there's so much more I wanted to unpack with you, but I'm glad.
Well, maybe we can do that another time.
I would love to. So let's figure that out, and I'll let you bounce and get on to your next thing. Thanks so much for taking the time.
I need a drink of water before the next one. I could tell you that.
Have some water, have some tea, take some breaths, and get some stretches in, and then we'll talk to you next time. Thank you so much, Cathryn. Take care.
All right. Take care. Bye-bye.
All right, guys, that's going to do it for this episode. Be sure to check the show notes for the links that Cathryn mentioned, and also a link to pick up her book, Crooked, Outwitting the Back Pain Industry and Getting on the Road to Recovery. It's really a must-read for anyone with back pain. And if you're looking for exercises that you can try to get your body moving and to reduce that fear that you might have around moving your body, then be sure to check out our YouTube channel at youtube.com/uprighthealth. If you want things that are specifically geared towards spinal mobility or hip mobility, then you can always just type in Upright Health back pain or Upright Health hip pain, and you'll find all kinds of free videos there. I hope you find all of these resources helpful, and as always, I hope you remember that pain sucks. Life shouldn't.